Hi, my name is Molly DeKruger, and I am speaking today about water governance and Indigenous people. Most Indigenous people have close contact and an intimate understanding of their lands and natural resources, especially water. Indigenous people's relationship with water is also deeply rooted in the spiritual realm, with water being viewed as a sentient creature essential to the survival and well-being of the land and its people. However, there are inequalities in water and sanitation service coverage between Indigenous and non-Indigenous populations worldwide, which leads to inadequate access to sanitation and water supply in Indigenous regions, which can be ascribed to a variety of physical, economic, and cultural restrictions. As a result, Indigenous people are considerably more likely to suffer from the multidimensional elements of poverty, such as malnutrition and other health-related deprivations. One case study by Hanrahan and Hudson in 2014 discovered and investigated many concerns with water insecurity in Black Tickle Domino, as well as the associated adverse health impacts. However, there are no health-based objectives, monitoring plans, or independent surveillance, in contrast to the World Health Organization's water safety plans, and there is insufficient operational monitoring and very little system assessment. Furthermore, water shortage in this and other Canadian Indigenous communities is a severe human rights violation. Citizens must push government authorities to make bold, forward-thinking decisions that consider local circumstances and lead to water security. Understanding the intricacies and challenges that come with generating and implementing solutions is essential. Undoubtedly, engineers have been working to discover long-term solutions to the community's decades-old water challenges, and this includes system evaluation, energy needs, and the identification of potential possibilities. Given its pervasiveness, water insecurity in Indigenous Canada necessitates more attention from academic scholars devoted to transdisciplinary and materialist methodologies. A study following 8 Indigenous communities was created through research partners. A community-based participatory research strategy was co-designed and co-implemented with Indigenous community-based coordinators and data gatherers. Water quality is one of the biggest concerns in Indigenous communities. The Indigenous residents were concerned about the possible health implications of water treatment methods, and their remarks echoed widespread concern in communities. They reported being unaware of the sorts of water treatment being used and not believing they were culturally suitable. They were irritated that their source water required so much treatment in the first place. Water was formerly thought to be life-giving, clean, and healing, but now is thought to be harmful to bodily, mental, and spiritual health. Participants mentioned taking precautions to protect their children from exposure to the overtreated drinking water. Another issue was that of water quantity. Water distribution and delivery differed throughout communities. Many towns are served by a truck-to-cistern system that transports water from the local treatment facilities or those nearby in non-Indigenous areas for a cost. Households are limited to a particular amount of gallons each week, regardless of family size or unique needs, such as cleanliness measures for persons with compromised immune systems or formula-fed newborns. In one case, a community member described the health consequences of insufficient supply. Inadequate supply resulted in a decreased capacity to maintain personal cleanliness, higher stress due to restricted drinking water sources, and a general inability to satisfy basic home water demands. Poor source water, interference with water delivery, and the availability and training of water hauling staff, and the conditions of trucks and cisterns are all mentioned as causes of drinking water poverty by research participants. The Clean Water Act is responsible for limiting pollutant discharge into U.S. rivers and setting surface water quality guidelines. Under the Clean Water Act, the EPA has created pollution control measures, such as regulating effluent limitations for industries. Section 518 of the Clean Water Act permits the EPA to handle qualifying Indigenous communities with reservations in the same way as states do for various purposes, including running each of the significant regulatory programs and receiving funding under many Clean Water Act powers. The EPA's updated interpretation of the Clean Water Act simplifies the application process for Clean Water Act regulatory process, including the Water Quality Standards Program. In addition, this reinterpretation allows tribe participation in the conservation of reserve water quality as Congress intended. Consequentialism equates moral correctness with maximizing good outcomes and limiting harmful consequences, such that the net positive effects are used to justify an act ethically. In effect, this approach imposes on the state with the duty to maximize the general welfare of the people. For example, one may argue that the utilitarianism justifies the human right to water and sanitation if doing so leads to the greater human good. Providing clean drinking water and proper sanitation services may lead to maximizing favorable societal outcomes. On the other hand, deontology considers conformance with moral standards as more critical than computations of happiness or any other consequentialist ideal. A person's ability to exercise their moral talents is defined by three essential values: autonomy, freedom, and human dignity. Kant derives one fundamental human right, the right to freedom, from these principles. However, some argue that Kant is so devoted to specific positive rights known as welfare rights, which are a set of standards that entitle one to governmental help to protect human dignity. For example, the right to water and sanitation is a welfare right by definition. Many have used Kantian principles to argue for such availability as a prerequisite to human dignity and exercise the right of autonomous agency. Within an integrated water resource management framework, or IWRM, all elements of water resource interventions are examined at the watershed level, with integrated planning replacing politically established management areas and traditional sector methods. The Global Water Partnership defines IWRM as an advocate for the integrated development and management of water, land, and associated resources to optimize the resulting economic and social welfare equitably while maintaining ecological sustainability. IWRM is a systematic procedure for the long-term creation and monitoring of water resource use and allocation within the framework of social, economic, and environmental goals. IWRM arose as a paradigm change away from the state-centered, sector-by-sector, top-down management model, combining the three E's of equality, efficiency, and environmental sustainability in the same management framework. Coordination of land, surface water, and groundwater usage between upstream and downstream users is required for sustainable water resource management. Planning is integrated across sector boundaries at both the basin and community levels and is based on open communication and awareness of people's needs, preferences, and capacities. The three E's of water governance can be characterized through efficiency in terms of water usage or by making water last as long as feasible. Water equity refers to the equitable distribution of water across different social and economic groups. Lastly, environmental sustainability refers to preserving water resources and associated ecosystems. Human rights-based approaches, or HRBA, seek to discover and investigate abuses of fundamental human rights relating to freedoms and access to services and resources to protect all people's autonomy and dignity. Given the interdependence of human rights, an HRBA comprises interventions to seek integrated ways to combat discrimination and satisfy the needs of the most disadvantaged and vulnerable populations. Lack of visibility, lack of representation, poor involvement in decision-making processes, lack of access to services and resources, and lack of acknowledgement to their right are 5 of the most prevalent difficulties for disadvantaged groups in policy creation and programming. However, using an HRBA in initiatives that engage with Indigenous peoples can help depict the various structural disparities they experience and pressure the government to adjust its practices and policies to address these inequalities. Because it requires governments to gradually implement purposeful, tangible, and targeted actions to attain universal, non-discriminatory access to water services, recognition of the human right to water may also be used to support Indigenous peoples' demand for access to safe water and sanitation. Even though states are not required to supply free water, it should be physically accessible, of acceptable quality, and it should be affordable. Dialogue is vital for establishing long-term relationships of mutual trust and support among Indigenous people, responsible authorities, and development organizations. However, for this discourse to be productive, proper resources and time are required, as well as the flexibility to adjust work plans in response to community requests. It is also critical to accompany the process beyond service creation and administration. Other essential needs in Indigenous communities is reducing inequality and more comprehensive record keeping of the health consequences of drinking water on reserves is required so that patterns can be identified and enough evidence can be accumulated to support the claims for change. Second, when resources are restricted, health practitioners might assist in prioritizing water usage within homes and across communities, for example, by offering advice on cleanliness practices and disease prevention. Third, people dealing with drinking water issues, health consequences, and those seeking to impact change all require mental health care. Health practitioners might help set better criteria for truck-to-cistern delivery methods to reduce pollution, or for educational institutes to help younger generations learn coping skills when faced with water difficulties.